how does TCM view infertility or any kind of fertility problems in male or females?
The theory of Chinese medicine is that you have meridians or pathways in your body, and when these pathways become blocked or stagnant or stuck, you're not happy, you're not healthy, you're not fine. Diseases can manifest, things can happen. And also, it's all about the organ system. So when we're looking at an organ or when we're talking about an organ, it's not as in the fact that it's not functioning properly. That's totally Western medicine. We're looking at it in an aspect of balance. For example, a diagnosis could be liver, blood, and qi stagnation with kidney yang deficiency and spleen qi deficiency. Now, that in Western terms can mean infertility, but the way we're looking at it, we're delving much deeper into different organ systems of the body that are affected. So essentially, if anyone came into the office, we're looking at it the same way. However, for fertility, there seems to be some consistency with irregularities and imbalances that we look deeper into. So for example, the kidneys in Chinese medicine, when we're talking about balance for the kidneys are responsible for creating the ovum and also creating a substance called Jing, which gives you peak performance in your body and keeps your body balanced and fine-tuned, both body, mind, and spirit. So with an imbalance of the kidneys, it's very important to get them balanced because they're behind this very important area here that many people get pregnant with. So a very important organ in the scheme of things. The next organ we look at is the spleen in Chinese medicine, and the spleen has to do with blood transportation or transporting the fluids in the body. So a lot of times if you were to just hit your arm and bruise very easily, we would say the spleen isn't doing their job because it also contains the blood in the vessels. So when you think about blood, that's all about nourishing the uterus and building the lining of the uterus and getting that supply of blood so that that uterus can help hold a baby. And then finally the liver, which we shouldn't say finally because the liver, honestly, anyone who walks into this office has liver issues. It's just lifestyle, diet, stress level. But when the liver meridian in particularly is blocked, the liver meridian starts at your feet, goes right up through your ovaries and uterus and right through your breasts. Has a ton to do with hormones and cycle and balancing that and emotions, and when that is blocked or out of balance, you're gonna have anxiety, depression, and potentially fertility issues just because of all the stress and the blockage. So the liver in Chinese medicine, looking at it from a order to conceive and have a healthy pregnancy, it's very important to have that free flow of qi in that meridian especially. Now your acupuncturist, when you go to them, should be wanting to open all the meridians and keep all the blockages unblocked.
Sure.
There are other organs, the lungs and the heart, and again, remember, we're not looking at how it functions, we're looking at balance. The heart has to do with your spirit or your emotions, so again, that can be affected based on how emotional daunting it can be to go through this, which it is and can be. If you don't have a great support system, if it's gone on for a very long time, it just can be very stressful.
Sure.
And then the lungs have to do with the emotion of grief. And again, you can see where grief can play a role in the whole fertility issue as well. The advantage of Chinese medicine is that we're treating your body as the whole entire body. So in saying that, we're not only treating infertility, we're also going to work on how do you sleep at night, how's your stress level, how are your bowel movements, because all of that can lead to being imbalanced. And what we want when you're getting prepared to hold a baby, carry a baby, be pregnant for that 9-month period, we want your body to be at peak potential. And so if we're just focusing on one aspect of your body, the rest of the body, based on your stress, your cortisol levels, your hormones, any imbalance you might have going on, is still going to be a factor in playing that role, because one thing can affect everything else.